Tēnā rā koutou anō. Kia ora. That's a hard bit over and done with. My name's Tuari, and very proud to stand here as chair of the board of the New Zealand Drug Foundation to say a few words. I'd like to acknowledge, as we just had, Ngāti Whātua for their support, and particularly the Odyssey House for coming along. I also want to acknowledge the speakers. We have a fantastic lineup over the next few days. I'll talk about them a bit more in a minute. And mostly all of you for coming and for gracing us and blessing us with your presence. Thanks for coming. I asked Ross through Jackson to write me some words that would make me appear incredibly clever and wise and inspirational. So if that happens, I did this. If the other happens, you said no. 1993, 20 years ago, we had the first, the Drug Foundation hosted the other Cannabis and Health Symposium. And some of us were there. And in fact, there are quite a few people, I think, in the audience today who were there 20 years ago. Wayne Hall, who will be opening our symposium very shortly. Nadia, I think, who presented your PhD research on the cognitive effects of cannabis. You're back again and still talking about how cannabis affects the brain. So, Ross Henderson, who, as many of us know, was the former director of the New Zealand Drug Foundation. Anyone else who was there 20 years ago who have come back today, and mihi atu kia koutou. You all look exactly the same as you did 20 years ago, as I'm sure I do. We believe that this International Drug Policy Symposium through the Maze, Cannabis and Health, is not only an important event for the Drug Foundation, but for New Zealand. We're hoping to restart and reframe the conversation about cannabis here in New Zealand and the health issues associated with our most popular illegal drug. It's been 20 years since we last held a conference focusing on the health effects of cannabis, and 20 years since we have talked about the health effects of cannabis in New Zealand on this scale. A lot of changes in 20 years, but a lot also stays the same. Take, for example, a tinny or a bullet, as they were when I was younger, as we used to call them. A small amount, 2 or 3 joints wrapped in tinfoil. In 1993, the price was about $20. It still is today, so I hear. And it probably will be in another 20 years' time. So, while the amount and the availability may fluctuate, the price is frozen in time, much like our response to cannabis. Despite almost 50% of New Zealanders having tried cannabis and almost 80% of people under 35 saying that they've used the drug, our response, primarily justice system focused, hasn't changed. We're known as a country with one of the highest rates of cannabis use in the world, especially amongst young people and Māori. Now's the time to talk about what things we should be doing to change this. We know that the status quo isn't working. Internationally, we know that the age people start using cannabis is getting younger. The median age for New Zealanders to try cannabis is 17, with 1 in 6 people trying it before they're 15. We're convicting over 1,500 young New Zealanders a year for low-level cannabis offences, most of them Māori. Young Māori males are more likely to be arrested, charged and convicted compared to non-Māori. Importantly, research by David Ferguson, who will be speaking tomorrow, shows that in 90% of cases, an arrest or conviction didn't change a person's drug use. Surprise, surprise. In fact, for 5% of people, their use increased. We need a new approach, one that recognises the growing science about the health harms of cannabis and acknowledges the evidence from around the world about more effective and earlier interventions. Of course, over the next 3 days, the conversations that we have here will not only inform us about the science, the health harms, and better ways we can address the growing body of evidence, but will also help us build a consensus about the best way forward. We believe we've assembled here an impressive lineup of speakers, some of the sharpest minds from academia, the treatment sector, community groups, policy makers, to share their knowledge and help us to have these conversations. They've come from around Aotearoa and all over the world. We welcome you to our country, and in particular to Auckland, because they're quite different, of course. From Dunedin, you know. The breadth of topics we are covering in a short time is amazing. Professor Wayne Hall will kick us off after the break with a discussion about how the picture of cannabis health effects has become much clearer since the first time we spoke about pot here in 1993. Paula Joseph, who was on the stage with me before, then joins us to talk about his documentary, Hiding Behind the Green Screen, which combined with his work as a psychologist will paint a picture about the cultural and historical aspects of cannabis here in New Zealand. And today we'll end with two of the best minds discussing the cutting-edge science on the impacts of cannabis on cognitive functioning, mental health and life course. Tomorrow we'll kick off with a look at the wider social and community impacts of higher rates of cannabis use and the impacts of the policies that we use to control it. The next obvious place to go is to talk about how we can reduce the harm the criminal justice system approach to dealing with cannabis use causes. The Drug Foundation will be launching its new e-therapy tool, Pot Help, tomorrow. It's an online help and support website for people wanting to reduce or stop the use of cannabis. We're pretty excited about this innovative approach, and we hope you'll join us to get a look at how it'll work. Fittingly, the conversation then moves to what the best interventions are to prevent early cannabis use and promote harm reduction and treat cannabis dependency. The final day looks at three of the most controversial issues around cannabis: medical cannabis. Three experts on medical cannabis join us to navigate the issues around whether it's a valid treatment option, its legal status, a debate between policy heavyweights, Steve Rolls and Kevin Sabet will examine the different approaches to law regarding pot. Should we regulate, or will that lead to more problems? And the third thing we're going to be looking at is synthetic cannabinoids. What is it? How did it become so popular? And what does New Zealand's new law mean for imitation pot? There'll be lots of talking, but it won't all be from people up here. They're not here to lecture you. Be prepared to test your thinking and engage in the discussion. We want you to leave this symposium feeling that you've been a part of a greater conversation, which will help to build consensus on the best way forward to address cannabis-related harm. The sessions have been structured to increase your participation, because what you have to say is valuable to us. If anyone has the solutions to the problems and issues we have in New Zealand at the moment concerning cannabis use and misuse, it is you, the people who are assembled here in this room. And please remember, when we talk statistics about users and abusers and percentages about what's going on, that the 50%, which is sort of half of you who have used cannabis at some stage, and the 80% of under 35-year-olds, please remember that we're talking about us. We're talking about our whānau, our friends, our children and our grandchildren. So please help us to create a pathway forward that makes the world a better place for them to live in. So while we're deliberating and thinking, just think about that. What information do we want them to have, our children and our grandchildren? And how would we want them to be treated? So that's probably enough from me. I know you'll all be starving by now, because you've been sitting in here for so long and you'll be dying of thirst. So it's a pleasure to formally open the conference through these words. And now I think we're going to break for a cup of tea, which will be just through there, and then we'll be resuming with Professor Hall. Nō reira, tēnā koutou, and welcome again. Kia ora.